Hello everyone, I'm Dr. Akhilesh Kumar, consultant physician, Wellness Hospital. So today I want to share with you an important thing which the purview of which is missing from the public. That is the ongoing pandemic which everyone is failing in their own term to notice. That is the non-communicable diseases like hypertension and diabetes. The latest trend we have seen from the second wave of the COVID is large number of people in very young age group like between 25 to 35 years have been incidentally diagnosed to have become diabetic. They have presented to hospital with one or the other infections like urinary tract infection, pneumonia or skin infection, and are being diagnosed to be with hyperglycemia and subsequently diabetic, or they are admitted in the hospital for some other cause, some other surgery or some routine blood investigation checkups, and they are found to be diabetic or hypertensive. So it is a high time that we realize diet and the body. So there is a saying which says that you are what you eat. So I want to emphasize that our mind and our body depends upon our diet. So diet is a major thing, the lifestyle is a major thing which is contributing to these two ongoing pandemics of hypertension and diabetic. So initially I want to address this to acknowledge you people who are ideally who are the people who are ideal to go for a screening testing for diabetes. So ideally there are 6 or 7 category of people who should go for screening testing for diabetes and hypertension. They are people who are above 35 years. You take it as onus on yourself to get yourself screened. Women who had recently a large child. Large child means a child whose birth weight is more than 4 kgs, or anyone who is having sedentary lifestyle like people who are software workers sitting for a long time in the offices, and people who had family history of diabetes. At least one of the parent have got diabetes. People who are having obesity, people who had a recent weight gain. These are the classes of the people who should go for screening for diabetes. And the other is symptomatic people. Symptomatic in the sense people who are having polyuria. They are passing more than 3 liters urine per day or going to washroom more than 6 times per day. Nocturia, people who are passing more than 3 times urine in the night. Frequent polydipsia, frequent intake of fluid despite presence of winter season, and recent weight changes, either weight gain, weight loss, loss of muscle mass. These category of people should take on themselves to screen for diabetes and consult a doctor. When you are screening for diabetic, always prefer to go for 3 tests: fasting blood sugar level, postprandial blood sugar level, and HbA1c together. So if you do these 3 tests, you will get not only your body's tendency to produce the insulin, basal insulin, stimulated postprandial insulin, but also you will get an average of your sugar levels of the past for 3 months. So please find out yourself whether you are at the risk factor for getting the diabetes, and do test it for diabetic and consult your nearest physician in case you become diabetic, because diabetes is a disease which stays with you like your spouse. Once you acquire diabetes, you are going to live with it for rest of your life. So handle the diabetes very well as you handle your spouse, so that for the next 20 to 30 years diabetes does not challenge your kidney, heart or brain. So signing off from Wellness Hospital, this is Dr. Akhilesh Kumar, consultant physician.